polio is transmitted fecal-orally. That is where you pass feces with the virus in it, and a child who is exposed to that feces puts his hand in his or her mouth. He can ingest the virus, and the virus gets into the gastrointestinal tract, and from there it's passed into the stool and is transmitted.
The fight against polio has been raging all over the world. The disease has been eliminated in all except 3 countries: Nigeria, Pakistan, and Afghanistan. Polio is more prevalent in northern Nigeria, but this is a narrative that the Core Group Partners Project, in collaboration with the Catholic Relief Services, International Medical Corps, and Save the Children, is working to change. There are many barriers to the success of this program: illiteracy, ignorance, cultural beliefs and practices resulting in non-compliance are some of the bottlenecks that the war against polio in Nigeria faces.
Core Group works in 5 of the 11 polio high-risk states. In the northeast, we work in Borno and Yobe. In the northwest, we work in Kaduna, Katsina, and Kano. And those are bedrocks of non-compliance, especially Katsina. And in fact, in all the states where we work, the volunteers conduct what we call in-between activities, where they go house to house, mobilizing mothers and caregivers on the importance of taking immunization.
The mandate of the Core Partners Polio Project is well aligned with what we do in CRS, especially our strategic core, which is basically to help the underserved and the poor.
One key strategy CGPP uses is the engagement of volunteer community mobilizers, or VCMs, and the volunteer ward supervisors, or VWS. CGPP also works with religious focal persons and utilizes several other strategies to ensure that communities are free of the polio scourge.
What I love about the CGPP project is that it takes what we've written on paper as strategies, as goals, as priorities, and it becomes life, it becomes flesh through the volunteer community mobilizers, through the volunteer ward supervisors. These are the people that take what we've written and they run with it, they run with the vision. And they go into all the communities, they go especially to the hard-to-reach areas, and they carry out activities to make sure that the health status of members of the community are improved.
VCM, they do house-to-house mobilization to mobilize women to go for RI, to go for ANC, that's antenatal care. They track defaulters, those people that don't go for RI, to complete their RI schedules.
CRS believes in subsidiarity. This is the understanding that community members know the terrain and the people in their locale best and can more effectively serve as change agents in their communities. The CGPP work with volunteers in each community where the polio project is implemented. Women like Asabe are headliners in the fight against polio.
Kafin in fara tsakani da Allah muna samun nakasu akan maganar rigakafi. Gaskiya ba a zuwa saboda ba su samu wayewar kai yanda za su zo su karɓi rigakafin su a gida na polio da kuma allurar wata-wata. To sakamakon BCM din da aka sa a bangaren wato ni kenan da nake magana shi yasa wayar da kai a nuna musu muhimmancin rigakafi na polio da nuna musu muhimmancin rigakafi na wata-wata allurar yara ƙanana. In na karɓi makirwan wasu su ne min ma dariya wai gani mace ne gani tsohuwa ina rike makirwan na kan ce a ku banni in yi ina ma unguwana ne ina ma ƙasa na ne saboda jama'an unguwanmu su samu lafiya da kuzari shi yasa yanzu nan headcam za a gama aiki magani ya ƙare.
Mun zo karɓa allurar rigakafi ne a wannan asibiti namu mai albarka na ɗan mani. Ina da yarana amma da yarana na baya ba na karɓan musu sakamakon Asabe BCM da take bi gida-gida tana faɗakar da mu tana wayar mana da kai muka samu ci gaba yarinya ta da na yayi na karɓan mata kuma na ga muhimmancin allurar rigakafi.
Working tirelessly to achieve total eradication of polio from her community, Asabe Abubakar's selfless service has received recognition at the state and national levels.
She's a kind of a woman who worked in a very high-risk community with very high number of non-compliance before she was engaged, and can also go to other settlements to be able to do engagement. she has been able to resolve most of the non-compliance in her own settlement.
The VCMs are the most important link in this program. And so I'm really happy because our volunteers are the forgotten arm of the project. They are forgotten because most people talk about the funders. They talk about core group, they talk about WHO, they talk about UNICEF, but they don't talk about the people that actually do the nitty-gritty of the job. So I'm really elated, and it's also a validation of the quality of training that we give them, because we train them a lot.
We are so happy that our system has actually paid off and translated into a very recognized platform, that such a VCM has been single-handedly picked out to be recognized as the best in the state.
Ya ƙara min azama, ya ƙara min ƙwazo, ya ƙara min ƙoƙari da farin ciki. Ba abin da zan ce ma shugabanni na gode Allah ya saka musu da alkhairi.
Having received an award like this, it just urges us and it pushes us to do more, knowing that the game is not over until we have been certified polio-free. So we are going to move forward.
And as part of moving forward, there are definite strides being made in the sensitization of men in the community.
Gaskiya a baya maza gabaki ɗaya ba sa barin matansu zuwa allurar rigakafi. Dalili kuwa suna tunanin ko akwai 'yan matsaloli akan allurar rigakafi da allura na mako-mako da sauransu da polio. Amma da muka zo aka fara kokari akan wayarwa da mutane kai, to gaskiya daidai bakin gwargwado yanzu maza suna batawa da matansu akan rashin zuwa allurar rigakafi.
The VCMs, as we call them, now do what we call convergent messaging. Now, convergent messaging involves not only talking about polio, but talking about nutrition, talking about water, sanitation, and hygiene, because there's a link between hand washing or personal hygiene with polio transmission.
There are potentials for integration in the project with the CGPP. For example, the area of nutrition, because one thing I found being on the field in Kaduna and in Yobe, there's a high level of malnutrition amongst the children under 5. So there's a good potential to do that, and we found out recently that some other partners in Kano are actually riding on that. So this is an innovation we can bring in. This is an area of integration.
At the close of 2016, close of 2016, the fiscal year, we had about 1.6 million children that have been immunized in our focal project areas across both states. So this is a very huge significance and a huge success that we've already achieved working with both states, Kaduna State and Yobe State.
The great progress made by the CGPP is constantly being tested by a few factors. The recent re-emergence of a strain of wild polio virus and the persistent insurgency leading to inaccessibility, especially in the northeastern parts of Nigeria, are some of these factors. This has not put a damper on the enthusiastic efforts of the team.
So as long as we have inaccessible areas in this country where children who are eligible for vaccines are not immunized, we are likely to have a resurgence. But the key to that is some of the interventions that the National EOC is currently supporting. There's something called Reach Every Settlement. What that means is that in every insecure area, the program works with military forces to see how they can reach children as early as possible and through whatever means possible, but ensuring that the life of workers is not put in danger. And that means training even military people to vaccinate children, and also training what we call the civilian JTF.
Last year, we heard the heartbreaking news of 4 cases of the wild polio virus being detected in Borno State, and that was kind of like a setback to the country. But one thing I must commend the polio emergency operating centers across the country is that they rose up to the occasion.
Although the road to complete polio eradication in Nigeria looks long and hard, the CGPP and her partners have covered more strides than the steps that lie ahead.
CRS, we are proud of partnership. We are very proud of partnership, and we don't play with partnership. And that's why our working relationship with both states' primary healthcare board has been so great. And we want to really say thanks so much to the State Primary Healthcare Board and also the polio EOCs in both states, in Kaduna and Yobe State. They've been so supportive working with them, because partnership is one of our key mandates.
Sakamakon aikin BCM shi ya kawo asibitin mu gashi ya ci gaba, an gyara shi, an kawo gadaje, za a kawo doctor, akwai nurse gaba daya, wanda muna mobilizing gida cewa duk abin da ya faru, ba lafiya ne, awon ciki ne, alluran mako ne, karɓar rigakafin polio ne, duk a zo asibitin gwamnati.
I see us getting out of polio, like the Rotarians say. We are this close, and I think we're even getting closer to the close that they're talking about, and we will soon be able to say we have closed the gap and there will be no polio in Nigeria.